Mike Gow here with Dentaltown UK, and I am with Brian Whittle MSP. Thank you very much for coming in to chat to me today. Now, we had a lengthy conversation about Brexit, but the other thing I wanted to chat to you about was the health of our healthcare professionals. Now, we touched on it in our last interview. About a year or so ago, there was a poll in the States that actually said that dentistry was number one, the unhealthiest job to have. It talked about exposure to contaminants, exposure to infections, and just the working environment, the position that dentists and nurses sit in, constantly stretching in awkward positions. We also know dentistry is a highly stressful profession. There's high expectations on dentists with regards to turnover and I guess their output of units of dentistry, essentially. High demands on us, high levels of litigation or threat of litigation. It is a very, very stressful and unhealthy job, as has been shown. So I thought what would be interesting, given your work and what you're doing with being the spokesperson for wellbeing and sport, what can we as dentists be thinking about with regards to our own health?
Well, I think in general, we have created an environment, a medical environment where our healthcare professionals are working that's not particularly healthy. It's quite interesting. I think a lot of my work is around the preventable health agenda. It's a big passion, but actually our healthcare professionals are unhealthier than the people we're trying to get them to impact upon. So the very first step, it's kind of like if I look at it as like an Olympic cycle. In 4 years' time, you want to be performing at your very best. But today, I'm going to have to take this first step. And one step leads to the next step. So the very first step we need to look at in the preventable health agenda is looking after the health of our healthcare professionals. Undeniably, they have a work-life balance issue. So I think we've got an environment where our healthcare professionals are struggling to be healthy. And by that, there only are three pillars of health. There is nutrition, there is physical activity, and there's inclusivity. There's nothing else. So everything we do in terms of whatever policy is brought forward on the environment which we work in should be cognizant of those three pillars. So they do need to. They do need to be. We do need to give them time to be physically active. We do need to be able to make sure that they have that sort of that nutritional of the ability to have a good nutritional background, and we do need to give them the opportunity to outside of the office to have that included mental health issue. Mental health is a huge problem within the healthcare profession. But if we look at the basis of where we need to be, I think that and there's lots of things impact on this. Recruitment impacts. The number of people working within the profession impacts. Impacts the number of hours you have to work. The ability to have breaks, the ability to go out and be physically active, the ability to have that time away. So we have to create an environment that allows our healthcare professionals to be healthy. Otherwise, how on earth are we going to impact on the bigger picture, the health of the nation, if our own healthcare professionals are not healthy?
Exactly, and it does boil down to that old "Doctor, heal thyself" phrase as well.
Yeah, you should know better. Well, I think if you want to really take it back to brass tacks, one of the things I would like to look at is how we are educating our healthcare professionals. I think. I found out that a doctor over a period over his whole training might only have half a day set aside in those years to look at physical activity. That's insane.
For themselves or to learn about it?
No, learn about it. To learn about that's insane. And all this. If we agree, hopefully we do, of the three bases of health. Surely we should be adapting the education programme to bring that much more to the fore. What we eat, how we move about, and who we do it with has a huge impact on the long-term health of individuals and the long-term health of the nation. So surely that the education system, has it changed dramatically over the last wee while? I'm not sure it has. The way that we live our lives has massively changed. We're much more sedentary. We know we've got a problem with obesity and type 2 diabetes, musculoskeletal issues. We know we have a problem with oral health. But has our education system adapted to that? I'm not sure it has.
Absolutely. And I think I often talk to my patients about people having a stress bucket, so that you've got an ability to deal with stress, and stress can be emotional and it can be physical. Now, everybody has a different size bucket, so some people can cope with quite a bit of stress, and other people have got a very small bucket. But the simple fact is, if you're not looking after yourself nutritionally and physically, when things go wrong with patients, when you have a high workload or high expectations, your stress bucket's already pretty full. So you start throwing other problems on top of that, and things get worse. And I think that's something we forget when we talk about mental health and we talk about the healthcare of dentists. Is the fundamentals. The fact is, if you get a 10-minute lunch break, you do have options with regards to what you eat. So don't eat the crap. Choose something that's going to actually help you.
And that's true. I mean, we the other thing about putting stress into the bucket, we have to find things that take stress out of the bucket. And for me, it's I either pull my kit on and go for a run, which I don't do enough of these days. I find again, my lifestyle. I'm talking about it, but I'm also being dragged into that lifestyle. Or I plug my guitar in and knock 6 bells out of AC/DC on my guitar. So that's the way that I take stress out of the bucket. But when we're talking about mental health, for me, we need to stop breaking it all up. It's just health, and mental health's part of our overall health. If you look, Sam H have done an awful lot of work and produced some really good papers around the need to be physically active for good mental health. The Mental Health Foundation it's food for thought. It's a great piece they've done around the impact of nutrition on mental health. These are things people probably don't consider. When we talk about mental health, it tends to be, what medication do I need? Rather than actually, if I could be more physically active, and physical activity can bring you into that inclusivity. If I could moderate what I eat, that will have a positive impact on my overall health, including my mental health. So, you're right, 10-minute lunch break. I'm one of the guys. I actually, in Parliament, make a point of going down to the canteen and sitting in the canteen to have my lunch. It might only be 20 minutes, half an hour, but I make a point of being in there and sitting at a table with a couple of guys and having a chat. But I look at the people come down, get to the canteen, get it in a carry out, and go back to their office. So they're not getting away from that sort of stressful environment. So I think those are the things we have to. With the way that we live our life, we have to make room. You have to make room for health, and it could be as simple as just doing those kind of things. I mean, when I'm on the 3rd floor, my office is on the 3rd floor, and I never take the lift. And everybody that's standing waiting for the lift hates it when I'm walking past, because they go, bugger. They now have to walk up the stairs as well. Damn you! When they're talking to me, if they're talking to me, they don't stop at the lift. They come and follow me up the stairs. And it's just tiny little things like that that I'm trying to do. I'm quite lucky. I'm used to, in my life, eating healthy food. So when I get into the canteen, I'm probably more unhealthy at home than I am in Parliament. I get into the canteen, I automatically get pulled towards the healthier food. Yeah. Mainly because if I ate a really unhealthy food, it would be pointed out to me. Everybody watches.
It's a bit like a dentist, As a dentist, you get pulled up if you have anything with sugar in it. But usually my line is, well, I get my teeth professionally cleaned by a dentist twice a day. How about you?
I think again, if we're going to I think we have to change the way we have this discussion. Yeah. Everything's bad for you. Well, it's not. It's not bad for you. It's if you do it in excess, we have a problem. I mean, this idea that burgers are bad for you. Well, good burgers aren't bad for you. I went down to with my daughter and a friend, my 10-year-old daughter and a friend. I was down at Loch Lomond Shores, and there was a sort of farmers market-y type thing there. And my daughter almost said to me, this just tells you, having a father like me, my daughter said, "Dad, can I have a burger? Can we have a burger?" And I looked across, and I actually recognised the farmer. He's one of my constituents. So it's his meat from his farm. Absolutely. In fact, and I'm going to have one as well, because that is quality produce, totally healthy quality produce. But if you go to,
a fast food chain.
Yeah, one of them. It might not be quite like that. Or you go and buy, a dozen frozen burgers or whatever. It might not be of that same quality. So I think the way that we discuss this has to change. Do I eat chocolate? Yeah, absolutely I do. But and too much of it, you can get your hypnosis and you can get me sorted out. But it's my big failing. But we've got to stop talking about things in terms of what's bad for you. I watched a program last night that sort of burst a lot of myths. I don't know if it was a very good program. It burst a lot of myths. Carbohydrate and fats and what we eat, and actually broccoli is a really good form of carbohydrate, and we need carbohydrate. Especially for cognitive functions, we need carbohydrate. How we ingest that is hugely important. So the conversation around food has to change, and I think that undeniably, within the dentistry industry. I mean, I watched this. This started for me when I was standing at a polling station, a couple of years ago when I was first got involved in Darvel, and we were opposite the bus stop. All the kids were getting there waiting for the school bus, and I watched this kid walk past with a big bag of these jelly sweets. And a can of, high caffeine, high sugar, one of those ones. And I thought, boy, the teacher's in for a treat today. And then you start to look at what they're all eating, and you're thinking, we need to change that. That's where we need to do our work. And healthcare professionals have that. They're the guys in the front line as our teachers. So we have to look after the health of you guys first.
Exactly, then pass it on. I think that's the issue when you're highly stressed and you have a highly stressed day. It's easy going for the easier option, which is the quick snack, the packet of crisps, the can of juice, whatever. But I think the importance is having that motivation to kind of make that fundamental change, and then probably being surprised by how big an impact that can actually have if you make that basic change. And we're not even necessarily, as you say, we're not necessarily talking about taking somebody who never exercises and has a bad diet and turn them into a daily gym attender who only eats vegetables kind of thing. It's about that balance. It's about cutting out some of the bad stuff, about starting to take a bit more exercise, and actually the impact that will have can be drastic.
Well, the people you're going to impact the most are the people who have the worst diet and are completely sedentary. I think again how we discuss this is 150 minutes. And there are people who look at 150 minutes and go, "No chance I'm getting there." But what we actually should be doing is shifting everybody along the curve, no matter where they are on the curve. I mean, if you want me a really, a daft example of that, if the only exercise you get in a day is to get off the couch, go to the fridge and stock up and sit back in the couch for the rest of the day, if you change that to you get off the couch and go into the fridge and taking half, so you have to go back again, you've doubled the amount of exercise you do. I know it's a very daft example, but it's wherever you are, it's trying to shift you along the route that little bit further. The way you're going to get the biggest impact is not the people at the top end who are going to the gym and running every day and eating a really healthy diet. That's not where you're going to get the big impact. It's down the other end where we have to look at not just the practical way in which we can impact or they can impact on their lives, but making it attainable. Because once you attain one thing, the next thing's attainable, the next thing's attainable, and you start to move along that route. And I think that's what we have to do. And generally speaking, and dentists tend to be reasonably intelligent people. They could probably work this out for themselves. But you're right. We fall into a habit, and I'm as guilty as anybody else. We fall into a habit of not exercising and taking food on the run and all that kind of stuff. Yeah, grabbing a packet of crisps and whatever it is. We fall into that habit. And making little changes along the way, when you see the impact the positive impact that can have on your life, it makes making another little change that much easier.
I think so, and so I think nutrition is a massive thing, and I think it is an issue in dentistry with dentists and the dental team. I think Christmas time was a great example. Patients bringing in lots of chocolates, they all disappear very, very quickly. The exercise issue, if you get a half-hour lunch break, the temptation, as you say, is to sit down. I'll just get that referral letter sent away. I'll catch up on my notes. When actually you could walk out the practice and walk around the block, and it's not a massive amount of exercise, but you've done some exercise and you've also cleared your head, so you're ready to take on the afternoon. And I think headspace is really important. And in our practice, we have had conversations about avoiding jumping into one of the dentists with a problem. So you're in the middle of a busy morning. You have to go and get something or do something. And if another member of staff catches you on the hoof and gives you another problem to deal with, that's when the stress bucket starts struggling. So we've got rules in the practice that if you've got something to say to the dentist, have an allocated time to do that. Don't grab them when their head's already buzzing with something else. Headspace is massively important. Whether it's playing a guitar, going for a run, or whatever it is you can find to do to get that ability just to clear all the other stuff out of your head, because it can get pretty full.
I say my default position for that is going for a run. Yeah. My thought process. I lose myself, and I can be half an hour into a run before I've realised that I've gone that far and can't find my way home. It's an age thing. I can't run as far as I used to. I don't run as far as I used to. But even when I got voted in, the day I found that I was in when I was in my bed in the morning, and I remember Ruth Davidson texting me to say, congratulations, fantastic, I'll see you at work on Monday. And I'm thinking, what? That's Monday. and the first thing I did was, I didn't know what to do. Yeah. The first thing I did was, I'd only been in bed a couple of hours. I'd go home at 6 in the morning, and I'd pull my kit on, put my headphones in, and go into the woods for a run to try and work through. Switch my phone off, which was melting, and just run and try and work some stuff through. And some of the things, when I'm thinking policy, it's my role is policy. I'm looking at a couple of policies at the moment that we're going to bring forward. One on technology, healthcare technology. And one on sport and activity. I'm stuck. A lot of good phraseology and embryos of ideas come from getting the hell out of Dodge and doing something else. So the idea, if you've got half an hour for a lunch break, take your sandwich, get out of the practice, and walk around the block. Do something. Walk to the put your big coat on and get the hell out of Dodge and change the environment just for that little bit of time.
I think so, and I think a lot of people believe social media gives them that escape, but I don't think it does. It just pulls you in further.
I think that the social media, the way in which we've used social media, is one of the major impacts on poor mental health. And I'm, again, it's a necessary evil, in if for want of a better expression.
You're probably watching this on social media.
Yeah, it can be it can be fantastic. Internet is a fantastic tool, that we never had before. But the way we use it now, and the way that I'm in an environment where we get smashed on social media all the time, but with these keyboard warriors who feel the need to tell me exactly what they think of me, because of a political party, and that undeniably that has an impact. That has an impact, and if you're not a resilient person, and you're not a confident person, I know how it impacts me sometimes. How on earth does it impact other people? So the way in which we use social media, I think we've got to be careful.
And that's true not only of social media, but that's one of the issues in dentistry. It's becoming increasingly litigious. The fear and the concern of patient complaints or patient dissatisfaction is a massive concern for the mental health of dentists, because the simple fact is we're human beings, and we're creating essentially man-made products to fit in a biological environment that is going to do its damnedest to break them down, and it's going to fail. It will eventually fail, and people's expectation is this is going to work, and if it doesn't work, it's your fault, and that is tough.
Well, I think there's a phraseology here that I want to, again, how we talk about things, I want to change. One of the things that always seems to be said is the demand in healthcare is rising. Mm-hmm. We need to change that. We need to change that to need. Mm-hmm. What healthcare do you need? Not what you demand, because, that's two different connotations for me. I think we are becoming a much more litigious society, and the medical profession is being hit really hard with that. I think, again, when we look at how health appears on the media, it's all the bad stuff. It's everything that goes wrong. What about all the stuff that goes right? And I've been involved. I've been involved in this. I'm involved in this with some of the most harshest issues around, one of our hospitals, and baby deaths around one of our hospitals. And the outcome of that was good. And they brought another 24 people into the neonatal unit because they were massively understaffed. But the way that's being discussed, we're not cognizant of how that's going to impact those that are working within that environment. So, our medical professionals are getting a real battering in the media because it's only the bad stuff we hear. We experience the really good stuff on a day-to-day basis, but that's not what our medical professionals are hearing.
Have you read the book Black Box Thinking by Matthew Syed?
Yes, I have.
It was a real eye-opener as well, not only in understanding that concept, but also in understanding how, as a medical profession, we've almost created a protectivity around ourselves where there's a fear of even admitting mistake, and that we've created an environment where we really can't make a mistake, which is ludicrous as well, because of course we do.
Well, I think it's one of the things that we've been working on in the Health and Sport Committee is around that idea that we want to learn from mistakes. We want to create an environment where we learn from mistakes. We want to create an environment where healthcare professionals feel comfortable coming forward when they feel there's an issue. That whole whistle. I hate the term whistleblowing, but that's the environment of what we want to create. But on one hand, but on the other hand, if you make a mistake, the law is down on top of you. The media are down on top of you. Politicians are down on top of you, trying to make political points. Why on earth would you put your head above the parapet? At the end of the day, in medical professions, mistakes are made all the time. And the vast majority of those, it's not life-threatening or it can be rectified quite quickly. But the problem is, though, that if you make a mistake, the human nature, cover it up. Yeah. You don't want it to get out there because of the potential implications.
The interesting concept that the book also raised was not even a sense of a malicious cover-up of I've made a mistake and I'm not going to tell anyone, but it also raised the issue of the self-justification that this was this and this, and it wasn't really me that was at fault, if that makes sense, because we have to. The only way you can continue is if you kind of believe that, if that makes sense. It's a fascinating book. If you haven't read it, then I recommend it. It brings up a whole lot of interesting topics.
I think one of the other things that I found when I've looked through with constituents when things have gone wrong is that the system tries to protect itself. and sometimes leaves the healthcare professional out on a limb. You take the rap, where actually what the issues are systemic, and that the communication within that environment's poor, or whatever that is, or there's a shortage of staff, there's a high level of staff away on stress-related leave, and put more stress on the staff that are there. So there's systemic problems. So it's not just about individual, mistakes which all of us make. It's about systemic and being able to look at the system itself. And again, I think the healthcare profession is very reticent to look at those systemic problems and make those changes.
Indeed. And again, that was one of the concepts of this book, and it calls it black box thinking. And they say, if there's an error or a mistake or something happens within aviation, and the pilot admits it within, I think it's 72 hours or something, then they won't be held accountable. The aviation authorities will have a look at, if that person made that mistake, how did the system and the protocols allow that to happen? And how can we support this person in the future so that other people don't make the same mistake? Even if it was his fault, how could he allow himself to get into that scenario where he made the mistake? Whereas, as you say, within healthcare, it's the individual. It was a rogue dentist, a rogue doctor. They didn't follow protocols. How did they get into that situation, though? What were the factors, and how could we change that environment and get into a black box thinking for healthcare?
Yeah, I mean, there will be those who make mistakes that deserve a full investigation. Of course, there are. But in general terms, what you say is right. I think that we have to be able to bring mistakes to the fore. We have to be able to bring them onto the table. We have to be able to discuss them. We have to be able to understand how the system itself can then protect. It's not just about protecting patients. It's all protection of healthcare professionals themselves. It's how do we protect that whole environment to make sure that those kind of issues don't happen again. And if we're not able to if we bury them, we'll just keep repeating the same mistakes over and over and over again. If I use one that I've been working on for a long time, that in terms of cot deaths, in terms of deaths during birth, the highest 70% of deaths in birth have an element where a poor reading of a CTG scan is part of the reason. But it's never brought to the fore. And what we've inevitably been able to do is force the government to actually make CTG training compulsory twice a year for everybody involved in that. Now, why should we have that? That is just an obvious thing to do. If that's the biggest issue, then we should be dealing with that. But it was hard. It was actually it was hard to bring it into the public domain, and then it was really hard to force the issue with the government. So we have to change that. We have to be able to be more open than that. Very easy to say, but we have to change the whole environment and our whole perception of the environment to say that actually making mistakes is human nature. How do we learn from it?
Indeed, and I think until we have that across healthcare and across dentistry, I think my advice to any dentist out there would be have a support network, even if it's one other individual dentist that you can sit down with and say, this is the case I was working on, I think I went wrong here, can we talk about it, and have someone you trust that you can talk to about things that are on your mind and concerning you with regards to clinical cases.
I think that's a very good point. Working with creating peer groups where you can have these kind of discussions in an environment that is safe, or you feel safe within. I think that is a very, very, very good point. I think it's a first step. I think we need to widen that out. We have to be able to widen that out. I think the power to me lies within the healthcare professionals themselves, and that power will lie within not being an individual within that system, but being groups of individuals within that system who can bring that to the fore. I think that's where the power lies, and that's what I would hope, I would advocate that happens across the medical profession, no matter which profession you're in, is that create that peer support where you can bounce ideas off of each other, where you can discuss where things could have gone better and how you could go better.
Indeed, and that's almost that kind of inclusivity aspect.
There you go. As I said, inclusivity is such a huge part of positive mental health.
So there we go. I think we've covered the full circle there. Nutrition, so going to eat something that's a bit better for you for your lunch or your snack. Walk around the block, take a bit of exercise, just get yourself moving and surround yourself with positive people. There's, again, on social media in dentistry, there seems to be regular factions and groups having snipes and having to go eat each other. Take yourself out of that. Don't get involved with it. Surround yourself with people that are supportive, regardless of what you're doing, and look after yourselves, I think, is the biggest message.
Thank you. Absolute pleasure.
Thank you very much.